Hello, everyone. My name is Sydney Kneller, and today we'll be reviewing Rockford Medical Center's value-based care plan at a high level. So for our agenda today, we will review the hospital profile, followed by research and analysis, financial strategies, and then we'll close out with a plan of action. For the hospital profile, I thought it would be easiest to break it up by who, what, where, when, and why. So who will this hospital support? It will support a 250 patient bed facility with 1,200 employees. Services will include cardiovascular, emergency services, neurosciences, oncology, pain management, palliative care, orthopedics, radiology, nuke med, and imaging, rehabilitation, ICU, surgery, wound care, focused prevention centers, and hemodialysis, and we will also offer a residency program. This will be a nonprofit short-term acute care hospital. The community will have access to educational resources and programs, as well as prevention centers that focus on primary care, obesity, cancer, stroke, and lung disease, which are factors that this community is struggling with. Where? This will be in Rockford, Illinois. When we propose that this hospital open in 2028 to allow for hospital zoning and planning, construction and inspection, hiring, equipment and acquisition, partnership and funding, acquiring licenses and permits, marketing, and training. Why? There are currently 340,000 patients that reside in Rockford who experience a higher rate of poverty, unemployment, teen births, obesity, cancer, death due to stroke, lung disease, mortality, and decreased access to care. So value-based care in the Rockford community can help to address some of these community issues and improve quality at a decreased cost. Value-based care is centered around programs and reimbursement processes that reward healthcare providers with incentive payments based on the quality of care provided to patients rather than the volume of care, which will be important for the Rockford community. So here I wanted to further dive into the research and analysis of similar hospitals as well as what the academic publications say. So two of the hospitals that are similar to Rockford Medical Center are Javon Bow Hospital, and the other is OSF St. Anthony Medical Center. Both are nonprofit hospitals that offer 241 staffed beds and are categorized as short-term acute care facilities located in the Rockford area. Javon Bow is generating 1.2 billion and OSF is generating 1.5 billion. So they are financially successful, and it's important to pull some of the lessons learned that they have in that area. I found that they both have a strong revenue cycle product via their EHR system, so it will be important for Rockford Medical Center to implement a reputable EHR system as well, including a patient portal for easy access. They have also invested in their infrastructure and innovative technology over time to ensure sustainability, which our hospital plans to do as well. However, these two hospitals also have room for improvement. When comparing against the national and state benchmarks, they have a lower overall star rating for timely and effective care measures. So Rockford Medical Center can compare well against these hospitals by meeting CMS measures while providing timely and effective care through evidence-based clinical and operational processes that lead to increased patient outcomes. The visions should start from the top down with a strong mission, vision, and culture. And then we also have a couple items here that are informed by academic publications. So there are 4 HFMA strategies. HFMA stands for Healthcare Financial Management Association, and they state that people and culture, business intelligence, performance improvement, and contract and risk management are important to support the financial and success of the hospital. The culture should inspire collaboration value from the leadership down. It should be also have a strong data infrastructure, metrics, and interoperability. It should incorporate evidence-based practices and then also include internal and external partnerships. And then there are also a few miscellaneous initiatives here. So outside of those 4 HFMA capabilities, there are also other important factors to consider that would increase value-based care as well. Those would include payment transparency, defining and measuring quality within the organization, innovation and infrastructure updates, chronic care management, telehealth services, management of shared savings programs to maximize reimbursement, improvement of operating costs, increase of patient volumes via marketing programs, development of capabilities, skill development, implementation of best practices and evidence-based practices, management and reward of employee engagement, person-centered care based around the patient experience, and then finally creation of multidisciplinary teams focused on achieving value as well. We also have some financial strategies that we plan to put in place. So to start, we have a revenue cycle management that focuses on front end, middle, and back end processes, which is a collaborative approach that addresses people, processes, and technology. So the front end will focus on negotiations with payers, contract management, insurance verification, prior authorization, and patient financial counseling to ensure a secure source of payment. Middle processes will focus on case management, charge capture, and coding of diagnoses and procedures by providers, while also providing that quality care that will contribute to value-based care. And then finally, back-end processes will focus on bill processing, posting payments, correcting and/or appealing claims and CDM errors, and supplying additional documentation that may be needed as well. These other items here are accountable care organization that we plan to participate in, as well as VBP programs or value-based purchasing programs, and then BPCI or bundle payments for improvement advanced program, which would reinforce value-based care, focus on quality rather than fee-for-service that focuses on volume, which is kind of the way that the healthcare industry is shifting towards. I also have a few more financial strategies here. So another important one is going to be a hospital value incentive program, which will also go towards that value-based care or help to emphasize it. And then we have data projects that will support technological systems and processes. So I plan to have an EHR system, a PHR system, clinical champions, e-prescribing, functionality that supports regulatory requirements such as meaningful use, a fraud prevention system, and then an analytics system such as Press-Ganey. It'll also be important to engage internal and external stakeholders to raise money for research grants, contracts, loans, donations, bonds, sponsors, investors, etc. And then other important initiatives would include key performance indicators and setting deliverables, setting a budget, and having a regulatory team in place to avoid fines and increase reimbursement. All right, and then finally, we have a strategic plan in place as well. We have some here listed for the short term, and that would include those up to 1 year. Those should be implemented at the start of the hospital within the first year to ensure success. Those would include setting a mission, vision, values, and goals that will align with quality care and VBP measures. We also want to plan and implement a data infrastructure model in any applicable systems, and then also plan and implement a financial strategy, including payment incentives based on quality, performance, and value. Identification and promotion of the use of quality measures through things like paper reporting, implementing measures of physician and provider resource use, engaging internal and external partnerships, sponsors, and stakeholders, as mentioned earlier. And then in the long term, we would want to focus on this after the short-term items to ensure sustainability and maintenance throughout the life cycle of the hospital. Those would include ensuring financial viability over time, maintaining evidence-based practices as the industry evolves, maintaining a strong data infrastructure over time as technology evolves, and then review and meet regulatory measures over time and also provide transparency and public reporting. There are more specific deliverables to meet these elements within each item of the detailed plan. However, for today's purposes, we are just going to review this at a high level. All right. Well, to wrap up today, I will be taking any questions that you may have. Feel free to email me at the address seen here on the screen. Otherwise, thank you so much for viewing my presentation and hope you have a great rest of your day.